We are also, so you all know, recording this webinar. We just are starting to record it. So for those of you that have team members that can't join today, you can point them to our website. It'll be posted sometime in the next few days, and folks can download the webinar and listen to it from there, because I know that that's what everyone wants to do in their free time. And our previous webinars are also posted on our website as well. So in this webinar, we will do a little bit of recap from prior. In the case that some folks weren't able to join, we do want to make sure that there is a little bit of a consistent intro before we dig into the details. Are we good on sound, Kira? Mm-hmm. Okay, great. You can go to the next slide. So again, just recapping a little bit on the transition in general. And again, apologies where this is a duplicate message, but assuming that some of you are new, is that we began talking about the transition last year and talked in greater detail at the HTVSA All Cohort in November, gathered a lot of information and shared the vision for the Department of Early Learning around 90% school ready by 2020. And so this contracts administration transition is all in support of that goal, as well as ongoing sustainability and expansion of the home visiting services account. So this is the last HVSA transition webinar that we have scheduled, though we may have others that come later. So again, we believe that this is positioning us for increased sustainability and growth to allow the monitoring functions of the home visiting services account to reside within a state agency, given that the majority of the revenue into the home visiting services account is public funds. So today's webinar will be primarily technical, so stay with us to the extent that you can. We know it's a little dry, but that's why we have pretty pictures of babies and young kiddos and their moms to help spice it up a little bit. So we'll go into a detailed outline now of what we'll talk about today, and then do a little bit, again, of recap of our prior webinar. Next slide. So we'll do a quick review of the kind of general changes of the HVSA, and then we'll dig into the key technical changes in the statement of work, deliverables, invoicing, and payment, as well as some of the data requirements that will be in contracts starting in July as well. We'll talk a little bit about reporting and monitoring. And please note that we've kept the slides high level. We're trying to do a balance of detailed information and detailed, but yet high enough, because soon we will be sending you a second batch of documents in which we really want you to be able to provide us some specific feedback on those documents. So next slide. So we've shared this one now on every webinar. It is describing what functions will stay at Thrive and what functions will transition to Dell, and where there are other changes like in data and evaluation. So please note that training and technical assistance are staying at Thrive, with some functions shifting with data and evaluation at DOH. Okay, next slide. I'm going to transition it to Renee to talk about specifically the timeline.
Great. So this timeline you've all seen. I think we handed it out well, we at least handed it out at the last webinar. So I'm just going to review it a little bit to say as you can see on the timeline, what we've done so far is collected a lot of information from people. And we conducted the first webinar back a month ago, and we released a set of documents to you at that point, draft documents. We're doing this technical webinar to, again, focus more again on the scope of work and some other items, and we'll release those documents, including what we're anticipating to be close versions of our reporting forms, at the end of next week. The whole while we're hoping that what you're going to do is see kind of what directions that we're going in, and have a chance to figure out, one, whether that makes sense, whether the things that we're offering to you are useful and they make sense to you, but also we want to get a sense from you of what impact that the changes that we're making are going to have on your administrative load. And so that's the kind of feedback that we're looking for. We're not necessarily looking for really line-by-line feedback. So we don't want to overwhelm you with all of these documents, but we do want to give you a sense, again, of where we're going, and then what impact that's going to have on you. Our goal within this timeline then is to release a final version of the pre-contract questionnaire, which was one of the documents we released earlier this month. We're going to release that to you in mid-March with the idea that now this is going live essentially. We'll ask you to complete that and turn that back in again in mid-April so that we can then turn that around and prepare contract drafts for release in mid-May. While all this is going on, kind of underneath is this, I'm holding open office hours during several afternoons a week for the whole month of March, so that if you have any questions, you want one-on-one conversation, you want to provide input, that kind of thing that's more detailed than perhaps an email, then you can do that. You can set an appointment up, and there'll be information again at the end of this webinar where you can set those up. So I think that's what I wanted to impart on this slide. So we can keep going. The next slide is, and like I think Laura said, what we've done is taken the old slides, and from the January webinar and added new slides as they relate to the different contextual slides that we have so you can see the whole process. So I'm not going to go through each of these slides in detail when they're a repeat, but this is again a repeat slide where it shows you the process and how it's changing, where Thrive initially administered a capacity assessment prior to developing their contracts. Well, we have a few additional things you need to do this year that will be only once, and then you never have to do it again, which are the intake form and registering with DES if you don't currently have a contract with the state. And then we'll have this pre-contract questionnaire, which we gave out last webinar, and we're hoping for feedback by the end of this month, which is a couple of days. Anyway, that's where I'm going to keep moving until we get to something new to ask for questions. But so we can move to the next slide, which is the contract process, which again shows you the changes that are going to happen between Thrive and DEL. And the biggest one being that every agency is going to have one contract per program, regardless of how many fund sources that you have within that program, and that all contracts will start on July 1st and last for 12 months. So go on. And this is one we spent a lot of time on at the last webinar in terms of the way that the contracts are structured slightly differently, with Thrive having an agreement with number of schedules that have specifics related to different contract expectations. DEL has a really short agreement, kind of couple pages, and then the body of the work of the contract is listed either in the exhibits, the scope of work, the budgets, and the general terms and conditions, which are really kind of more the legalities of administering a contract. And then we have attachments that will be supporting those contracts. So again, not new, so I'm going to keep moving, actually. And the next slide is new, which has to do with the statement of work, which is where we're going to start focusing today's webinar. The next two slides are going to show you basically how we organize, or we're going to organize, the statement of work for the HVSA contracts. So you can see the pre-contract questionnaire that you're going to complete in the next 2 months is going to inform what the actual detail is within our scope of work and the deliverables that we'll be monitoring for. But you'll see the first, so I'm just going to read these off, and then each one of these items is going to have a more detailed slide behind it. So we're looking at model fidelity. No surprise, that's what you were doing with a lot of the whole kind of focus of the Thrive contract implementation plan was around fidelity. And within that, staffing and supervision, the service area and priority populations that the contract will address, participant recruitment and enrollment, home visiting service delivery, systems building and connections, and we're going to keep moving to the next slide, publicity and acknowledgments, budget and financial compliance, data collection and reporting, continuous quality improvement, that's actually a new section, and technical assistance. What we're going to focus on subsequent slides, sorry Laura, it's coughing, is really what's changing. So you'll see a lot of stuff between the two contracts may be reordered or reorganized, but what we're going to focus on are the new items so that you get a sense of that. So anyway, I'm going to go to the next slide unless there are any general questions around the way we're structuring things. So we're going to talk about each topic individually. So any questions on kind of general scope of work? Okay.
you do have questions, just feel free
Oh,
to type them in, and we may not get to them right at that moment, but I'll make sure that we go back and address each question.
And you can also raise your hand on the little control panel as well. And
Yeah,
we'll be calling you.
So the first specific area that we're going to highlight out in the scope statement of work is actually a new area in the sense that we're creating a deliverable around model fidelity in general. And I think in the Thrive's implementation plan continuously refers to model fidelity under each deliverable. But we're going to ask for kind of an overarching model fidelity indicator. And so with the goal that we're always moving towards or progressing towards model fidelity with each program, regardless of whether you're an evidence-based program or a promising practice. So for those of you that have national affiliate status, we're going to be asking that you get a letter from your national model basically indicating your positive affiliate status within that model. So for most of the programs, or for all the evidence-based programs, you'll be able to do that because you have a national model. For the promising practices, we're still working on what this might mean for you. I know for a couple, I spent some time looking into it. There are some national offices, but they don't always offer a certification. So then there's going to be a process over the next 6 months where we're going to be working with Thrive on identifying that, and that'll be kind of woven into your CQI and TA process as well. So hopefully it won't be additional work. It'll just be interwoven with those efforts. But so in general, our first deliverable in the scope of work is going to be this indicator of model fidelity overall.
And I'll pause really quickly and say that this has been a pretty common approach across the nation for states. One of our requirements as the state agency that's administering this program is to assure model fidelity, but since that really, the authority for that really resides with the national model offices and their review of your performance towards their essential requirements or model fidelity indicators, this is a way for us to still assure that we're adhering to model fidelity, and has been a common practice because we're in a bit of a unique position, unable to do that piece without the National Model Partnership. Looks like there's one question. Kira, can you read it?
It says, so who do you recommend we get the letter from? Our nurse state consultant or somebody else?
We will provide specific guidance on that, and we've already been in conversation with both the PAT National Office as well as the NFP National Office about that. I'm not sure yet whether it'll be the regional person, so I believe that's Lynette, or whether it'll be Gwen, but I believe it'll probably be the regional person, and we'll follow up with specific guidance on that.
There's another question. It says, is a contract in good standing with the national office adequate for proof?
Is a contract, I'm going to repeat the question, is a contract with the National Model Office in good standing enough for proof? No. Will require a letter. Unless it's with one of the promising practices, and I'm not sure who asked the question, and we could maybe talk about that as well as part of the structure for the model approval.
So this is actually a really good example of where we're interested in your feedback. So if you have ideas, you can certainly chat those in today, or if you think about it, you can email us, and it's certainly something that will come up in conversation between you and your lead, model lead at Thrive as well. So we're all, like I said, it's something we're still working out. But we would like to hear from you. So, are there anything else? Okay. The next slide talks about staffing and supervision, and for the most part, these are deliverables that you've had to meet, and they've been part of your implementation plan. We're putting them all together. We're putting everything related to staffing, which includes your staffing plan, your supervisor qualifications, as well as the supervision schedule, and then any staff training and professional development that are expected. So those are all pretty much the same. Oh, and policies at your agency around retention and filling vacancies. The only thing that's really new in this section is that we're going to ask you to provide us your staffing plan basically by individual, so that we can see how each individual in your program is funded across the different fund sources, and we're going to need that just to track for future things. So we're going to ask the staffing plan be a little bit more detailed, but it rolls up into the same kind of overarching, how many home visitors, how many supervisors, how many additional data collection staff, other types of staff that are supporting your program. But again, we're going to want to see that those folks and how they're distributed across the different fund sources if you get more than one source. If you only get one fund source, then it's one column and it's just the same as you've actually been doing it all along. So that's the staffing section. And again, what we're doing is kind of combining within this one chapter essentially of the statement of work, different sections that were in the implementation plan in Thrive's contract. Any questions?
Yes, we do. Okay. So will that letter be collected annually during the second quarter reporting?
If you're talking about the model fidelity letter, yes, that's actually our goal. In our conversations with the national models, they feel like the best time to give out that letter would be sometime in December. So we thought, well, the collection of that would be perfectly timed with the second quarterly report, which will be due at the end of January.
So will you be wanting specific FTE numbers, i.e. 0.5 FTE McPhee, 0.25 TANF, etc.?
Yeah, and actually this is because we haven't been able to hand out, well actually I think if you actually look at the pre-contract questionnaire, it's spelled out in that pretty much what we're going to be looking for, and that's where in a lot of cases what you see in the pre-contract questionnaire feeds directly. You'll get a sense of what's in the scope of work, because what we're asking you to put in the pre-contract questionnaire is, say you have home visitor A and how much of it FTE is funded by McVie, TANF, or other state dollars. It's a column, it's a table, and we're going to reproduce that table essentially in your scope of work as your staffing plan. So how you complete the pre-contract questionnaire drives what will be in the scope of work in this area. Does that answer the question? Or are there other questions?
There was two that were almost
Really
the same,
similar.
so I think we've answered them.
If there are no other questions on staffing, we'll move to the next slide. And this one, we'll talk about your service area and priority populations. This is completely driven by the pre-contract questionnaire and will not be in any way different from the Thrive contract. So we keep moving.
And by any way different, there may be a few different words.
Yeah.
But the intent is the same.
Sorry, yes. It may be, yeah, exactly. It may look different because it's organized differently, and then we were saying, yeah, but go ahead. There's a question?
It says, what if you have staff that are funded not by a specific funding source, but by a combination of funding sources blended together?
That's a good question.
That may be something that we need to talk with folks individually about, because we will need to identify to some degree how we're braiding those funds, which means that we can kind of allocate specific time to specific funding, but we can probably, I think it's a kind of a technical question, so we should make sure we have a conversation. And my recommendation would be at some time in the next bit to be emailing either the home visiting inbox or Renee directly, and we can sort that out.
Yeah. And it also may just be something we have to work out on your contract. And so I think when you see the pre-contract questionnaire and it may come up, we might need to leave space for you to figure out how to explain that within that document. So, okay. Anything else? Any other questions?
Excellent.
So is the next slide for, I think it's participant enrollment and retention. One back. Okay, did you get that? No, yeah, that's why I was. This slide, this participant enrollment and retention is going to be very, very similar to the Thrive contract that you currently have. Certainly, I think what we're doing with this one is pulling from a couple areas within the contract, so it's going to look slightly different because like for example, the first bullet says voluntary participation. Well, I think that was actually buried in a schedule, not in the implementation plan. But we're calling out everything related to participant enrollment and retention that was in your entire Thrive contract is now going to be sitting in this chapter, basically, of the scope of work. So I think, again, there's no substantive changes until the very last bullet. We certainly want outreach and recruitment, which again is driven by your pre-contract questionnaire, and the number of families or slots that you have will be very similar. That the expectation is that you're going to meet at least a minimum threshold for your active caseload of 85% of that number of families. So that's all the same. But then the last bullet has to do with enrollment-related policies and procedures that were really being piloted amongst the cohort 3 programs this current year. That will apply now to all programs in subsequent years, or next year, which is from this year. So that's the newest thing on that. Any
We have
questions?
another question.
Yeah.
It says, for clarification on staff, the pre-contract questionnaire, are we supposed to enter each staff in our home visiting program with Dell and those we have in our EHS program? We have more home visitors than there is room for on your questionnaire.
We would only want the staff that are funded by the Home Visiting Services account contract, but we realize that in some cases there may be they may be funded by other funding as well that's not within the HVSA, so that's where that other category is, but it's really for the team members that are supporting the work that's associated with the contract.
And and this document that we sent out is just a draft, and I think that's good information for us to know when we develop the final document that we might need more lines for home visitors. So.
Any other questions, Karen?
No. Okay, so then the next slide, Laura.
Yeah.
I think you need to work off of this one.
I got
Well,
it.
you might not.
Got it.
Oh, you got it. Okay.
All right, so this is Laura again. Thanks, Renee, for taking us through that. I will attempt to keep it together with my coughing fits here. I'm going to talk through a little bit more in detail about the statement of work with respect to the kind of the bulk of the work, which is home visits, right? So Thrive has done various different things with describing the number of home visits that are derived from the capacity assessment right now, and they ask you to do, I think it's the estimated home visits per year, as well as by month, as well as a range. We're not going to take that approach. We're going to shoot for a target number of monthly home visits and annual. We'll continue with the screening and assessment requirements, as well as require you to do some reporting on the types of referrals that you're making with families, and in some cases the results of those referrals. I'm going to pause right there because the next piece is a new element that we're considering, and it's largely contingent on budget. And when I say budget, it's budget, our state level budget. With us being in legislative session right now, and our budgetary environment over the last year having shifted significantly with some shifts in private funds as well as federal revenue, we are hoping, but are not sure we will be able to do it, to be able to do what we're calling some performance payments in the contract. So we still have to let settle out the legislative session so we know a little bit more about our budgetary future before we can confirm this. But what we'd like to do, at least test it out for a year, is have some performance payments that are on top of your overall contract amount for performance achieved with a specific few indicators. And one of those that we're considering and would like a little bit of feedback, so get ready to chat in, is the percentage of completed second visits. So we know that dosage, the amount of visits that families get are relative to the kinds of outcomes that they achieve in home visiting. And so we were wondering how we can incentivize getting those dosage up, the second visits. In most cases, we know that sometimes it's harder to get a second visit in the month or sometimes a week, depending on which program you are. And so we're exploring whether it be a 75% rate or an 85% rate. We haven't defined the performance measure yet, But we're curious about any input that you might have as we're thinking about defining a performance measure with respect to second visit frequency. And it could be something like all of the families enrolled, 75% of them get a second visit during the month of the prior month or within the quarter or something like that. So those are the kinds of things that we're thinking about. In order to make this more meaningful for you, we'd like you to think about how we might define that. So please feel free to take a quick minute and chat in some ideas. And if you don't have any now, you can also email them to us later. Again, this is our conceptual thinking, and we're projecting out some budgetary cost of what this would take for us to do it. But with our environment being a little uncertain right now, we're not confirming any of that. So, but would like feedback if we did.
So we are getting some feedback. We also do have a question that came in right at the start of your comments, so I'll address that first. It says, will the screening and assessment requirements continue to be different from the model requirements?
Will the screening and assessment requirements continue to be different than the model requirements? I'm going to take a crack at answering that, and then I may need to have the person chat in to see if they need further clarification. We are continuing on with performance measures, and we'll talk a little bit more in a few more slides about our all home visiting services account aligned measures that we'll be implementing starting in July. And there may be cases in which there is an assessment that's required that is not required by the model, but there also may not be. So I don't know if I'm speaking to that specifically enough, but the answer is yes, it could be the case, but depending on the model, and I don't know who's asking the question, it might not be the case. So I'm going to pause there and see if there's any other questions or follow-ups from that one.
Okay, so that one's
Oh, for parents and teachers.
Yeah. We've had a lot of people chime in on the incentive idea.
Great.
Do we want? They're mostly just comments.
We'll synthesize the comments and follow up with any other questions later, but we'll not read through them right now.
Perfect.
That's okay. We'll stick to the questions. All right.
Here's another question. Can you give an example of the reporting for referrals, summaries, and results?
Yes. I believe right now in the quarterly reports, you all already provide a summary of the types of referrals that you're providing for families. For some of our programs, there's an example is we have a McVie measure around of the referrals that were made, how many got connected to services. So we're contemplating whether to include any reporting on that kind of measure in the quarterly report as well. So an example would be a mom or dad screens positive for depression. A referral is made, did they get connected to services? That would be the kind of report that we would be looking for. More information, we'll talk a little bit more about the reports in a bit, and then that will also be in the package of materials that get sent out in about a week and a half. Any other questions, Kira?
So this one says, for those of us with TANF, it's been impossible to reach 85% of our capacity. It doesn't seem realistic and brings our overall enrollment down. I have a comment.
Okay. So the comment is about TANF and TANF enrollment and the expectations for enrollment. Thanks. Something that we need to keep talking about.
We've just had some agreements with that.
Okay.
Seems to just be comments at the moment.
Okay, sounds good. I'm going to go forward with the next slide. So the next part of the statement of work is around systems, and when we say systems, we mean partnerships and communities and supportive services for families who refer into home visiting and out of. So right now in the contract, you also report on some of the partnerships in communities. We'll continue to do this, as well as require that you continue to build those both for referral and for coordination in your community. We, at this point, aren't anticipating any specific memorandums of understanding, though we may recommend some with systems partners. So that's pretty similar to your current contract, not a lot of changes there. All right. So I'm going to shift us a bit into data collection and reporting. Any questions, further ones? Comments?
Do you have the approximate due date set for the pre-contract questionnaire? It would be helpful to know due to staff vacation plans in April.
Oh, yeah.
Yeah, we're planning to have it open for about 3 weeks, 3 to 4 weeks. Our hope release date is mid-March with a mid-April due date with fluctuating a week on either side. So thanks for asking that. And I will say it is pared down from the capacity assessment, and it was in the package of materials that you were released in February, at the beginning of this month. I think it was the first Friday of the month.
Yeah.
So you can get a sense for starting to fill that out now. We haven't gotten a lot of comments on those, and Renee will talk a bit about when we need to have any comments back on that because it will go live not long after we close the end of this month. So we've had many visitors into the room, if you haven't noticed. We've had a few interruptions. Everyone wants to know about the home visiting services account transition.
That's why we're turning around.
Great. Okay. So shifting a little bit to the statement of work around data collection and reporting, and noting that this has typically been in your Schedule C for the Thrive contract, and I know because I read those a lot. And we have outlined here some of the requirements. I would say generally the themes and the content and the intent of what's in the current Schedule Cs will be outlined in a section of the statement of work, and here's an outline of that. We're not going to go into detail because I think it's really best for you to have that in front of you before you react to it, but generally the same concepts with a few tweaks that we'll talk about in subsequent slides. So continuing to participate in planning and training, implementing best practice for data collection and management, accurate and timely data collection, and of course keeping all your data secure and complete, as well as participating in other evaluation opportunities as they emerge, and some will over the coming year, particularly around our workforce study that we'll share more information about in the coming weeks. All right, we understand that this is one of the parts of the work that is probably shifting the most significantly for some of you, not for others of you. So I want to just pause and recognize that while I am a bit of a data nerd, that's not often the worlds that you live in. And so acknowledge that this is not easy. It can feel really daunting and complicated. And the intent is for us to really be able to tell the story of what the Home Visiting Services account is doing across all of our programs. So starting in July, we will be asking our programs to collect data on a number of different what we're calling basically performance measures. Not all of them are really program performance measures. Some of them are systems performance measures, as well as enrollment and demographic. While you report some of these kinds of things in the Thrive quarterly and annual reports, we don't really have a way to synthesize the story of the Home Visiting Services account and the impact that we're making in the way that we hope to. And so over the coming year, we'll be supporting all of our programs to begin implementing these measures here. And I'll pause here and note that these will be released in the package of materials in greater detail, and we'll have some specific questions for you in what we're calling a public comment period, basically a review period that will be about a month long to provide feedback on these. So these measures that you see here are just the concepts, and we realize that some of our programs maybe don't support parents who are breastfeeding, like Parent-Child Home Program. They enroll families later. So we know that, and that's considered in the aligned measures, and I'm not going to go in detail of each one of those to address the nuances of where models may or may not address these specific issues. But in general, these are going to be required by all programs. So these measures come from a set of measures that were defined by our federal partners through the Maternal Infant Early Childhood Home Visiting Program with a few little tweaks, but in general they're aligned with the MCV measures. So if you're a MCV funded program, you're already collecting these. It's for our other programs who may or may not be doing these data collection points. So these may be new for some of you. Also, some of the demographic data will be collected in a slightly different way so that we can really tell the story in the same way across all our programs. I'm going to pause there. I anticipate there may or may not be some questions at this time and see if any have come in that we can respond to. And our DOH partners are on the phone as well. So they're also listening to questions as they're really helping us, as I describe it, operationalize, put this into action in the field, and have been meeting with some of you already to talk through and think about these things.
We do have a question. It says, is the intent to pull this from the model data system?
Can you tell me who's asking?
Susan Schultz.
Yes. Yeah, when the model collects the data, the intent is to pull it from there. So for Parents as Teachers, those programs using Visit Tracker, and the Nurse Family Partnership programs using Efforts to Outcomes, the ETO system, that will continue to be our data source. But where now we really are only requiring these measurements for our MCV programs, they'll be required for all of them. Yeah. Okay. Alrighty. And there will be a lot of guidance. I mean, these are concepts. There'll be a lot of guidance as to how these are defined and when we'll be looking at them and those kinds of things.
And support.
Yes, support, not just guidance. You're right. I thank you for that. Yeah, next one. Thanks. We wanted to reintroduce this conversation as well. We talked about this in our last webinar, but wanted to make sure that we called it out again. We've had just a few questions on this, so we wanted to reiterate some of the changes around data sharing as well. So currently, all of our contracts require that data is shared, and for the purposes of reporting, evaluation, and CQI. In the coming year, we'll be adding a requirement to share. Right now it's de-identified data. In the coming year, it'll be identifiable data. It describes that in the data sharing agreements that were attached in the packet of information that went out in the first round. Now there's some legal nuances to this, but basically the template that was shared, because the data sharing will happen with Department of Health, the template is the Department of Health template with customizations for our program. So we are fielding questions about the data sharing agreement, though the data sharing agreement will be executed with Department of Health, which is the case for most of our NFP and PAT programs already, but we'll be bringing in some other programs to that as well. I want to note that there's a couple of reasons why we're structuring it this way, and we talked about this in November, and we'll continue to talk about it, is that one of the things that we aren't able to do now is identify how home visiting contributes concretely to the goal that the Department of Early Learning has for the 90% of kids being school ready by 2020. So this will allow us to be able to track kiddos who get home visiting services as well as get other DEL services and the impact of those on their kindergarten readiness scores. So that means linking with other data sets within the protections of federal law, state law, and when appropriate, the Institutional Review Board, which is the body that governs anything that's considered research. And I'm going to pause there and see if there's any other questions. I know that this topic is a little bit complex, but we've already worked on setting up a couple of conversations with folks because this is one that we know will take a bit of time for your agency leadership or administration to sort through.
So we have a question, it's not actually related to that. It says, if we are funded under 2 different cohorts with Thrive, will we have 1 contract with DEL or 2?
With exception of 1 entity, the answer to that, this is Laura, is one contract. Yeah.
1 contract per program model.
Per program model.
Regardless of how many fund sources that model we receive.
And that also means the monthly and quarterly reports will be a single monthly report and single quarterly report with some of the elements that will have funding specific questions like enrollment, and then otherwise will be generally how's your program doing. So it's a great question. Thanks for that.
Okay. So in previous contracts, DEL had a DSA with the NSO to release our data. Will DEL and DOH be doing this again?
Yes. However, the national models still require us to have a data sharing agreement with the local programs. It's a little bit complex, but we currently have a business associate agreement which has specific bounds within the legal realm of sharing data and use of that, and we'll continue to have a contract with them that specifies data sharing, but it will also require us to have a data sharing agreement with the local program. And we've already been working with the national models on this. They're all aware, and have provided us some language about what it will take for this as well.
Can a family waive or decline the release of this identifiable information and still participate in the HV program?
That's a good question, and one that I'm going to answer with a tentative, because I think I know the answer, but still confirming. And sorry I missed this. It's actually in this slide. We will have, one of the requirements will be a parental consent. You already do parental consents for participating in the program, and we'll provide some language about sharing data. And my initial response is yes, they'll be able to participate and decline data sharing. And that, I think we still have to figure out how we're going to track all that, but that's the intent at this point. And we'll notify you all if that changes, but that's our intent. Am I saying that correctly? Okay.
Will you be sending us copies of the agreements?
Oh yeah. And I don't know which agreements those are, but the data sharing agreements have already gone out. Those went out in the February batch. So I'm not sure if it's that agreement that people are articulating about, or the parental consent, which has not gone out.
Riley is messaging saying they were dropped off the call, and now when people are coming back, they can't hear anything. It might just be them.
Okay. Can I have a call back in maybe again?
One of the things, we're kind of having some technical issues right now, but one of the things I wanted to mention, just use again, because I'm still actually learning this, and maybe it helps to have another person say it a slightly different way, is the data sharing agreements are actually your data sharing agreements. We issued what would be a suggested template. The data sharing agreement has to originate from you as a contractor, as the lead implementing agency, and you're agreeing to share your data with the Department of Health. The purposes are listed in that data agreement for what that data sharing agreement, for what those purposes would be. It's important within our contractual requirements that you have to have that data sharing agreement in order to share data with the Department of Health. But they have developed the template for it because they know what they essentially need, and it's an agreement between you and them, and we feel like they have the expertise to develop that, what the content of that should be, if that makes sense. So, but it's really an agreement that you have with the Department of Health that names the Department of Early Learning as receiving that data. In order to have a contract with us, you have to have that agreement in place. So does that make sense? It's kind of a circle, but it's not really an agreement between you and us. It's an agreement between you and the Department of Health. So I don't know if that makes it clearer or makes it less clear, more confusing. So.
Do you have a sense about whether or not changing from de-identified data to identifiable data will negatively impact family engagement in our programs?
Well, that's a really interesting question. And I should have prefaced this before, but the Department of Early Learning captures identifiable data for all of our other service delivery. Home visiting is actually the only program that we do not collect identifiable data. So that includes our ECAP program, which is our largest program, collects all identifiable data for the families, as well as our early intervention, our early supports for infants and toddlers. I think that we can certainly support you in scripting and thinking about how you talk about that with families. Our hope is that it doesn't, but know that we need to monitor that and understand what the impact is on data sharing for families. But know that we are actually the holdout in doing this, and everyone else is already sharing identifiable data as part of their service delivery model as well.
And I think it's really important to pay attention to the third bullet on this slide too, around data security and protections, because simply by enabling the Department of Health to release identifiable data to Department of Early Learning doesn't mean I personally might have access to that data. That there's that only the folks who would be doing the evaluation components that would need that identifiable data would have access to it. And so it's not just this general, okay, we're sharing data and everybody gets to see that data. That's what having this, and that's why we want you, we don't expect that within your organization you share data across staff. It's only the staff who collect that data and then it goes into the system, and other staff at your organization wouldn't have access to that data. That's 100% true here as well. Even we may be working on the program, but we wouldn't have access to people's individual data. So it would simply be for the purposes that would be identified in that data sharing agreement, the folks who would need to have access to it. So, but that's nuanced, and that's something we could talk about at this level, but a family may or may not understand that. And so it's you know, I'm just sharing that with you so that you realize that. So
next question. If we have a consolidated contract with DOH, can we wrap the data sharing into the consolidated contract?
That's a good question, and one that we'll follow up with on Riley, and Kira will know who asked that. And I'm guessing that's a health district that asked that question, or health department.
May Catlin?
Yes.
Okay. She continued, since we already messaged to the current enrolled clients, would the data sharing start with the newly enrolled for identifiable data?
Good question. It's probably all families enrolled, but there'll be a consent process, and we haven't identified that, so Meg will sort that out and follow up as well. Thanks for asking that.
Pretty much.
Okay.
There's a few comments.
Okay, we'll read through the comments as well afterwards. Great. All right, the next section is on continuous quality improvement. And as you all know, we have been focusing over the last year some efforts to support you on building out continuous quality improvement teams and structures within your agency. Some of you already have those. Some of you are really starting fresh on this. So we are going to outline in a little bit greater detail in the coming contract specifications that we're hoping that you're able to roll out in the next 12 months. And we're designing the quarterly reporting structure around some of the PDSA cycles, so the Plan, Do, Study, Act. So in the first quarter, for example, you would report on who your CQI team is and what your plan is, and for the next quarter. And then on the following quarter, you'd be reporting on what you've done. We are designing across our state partner team the technical assistance support structure. Some of the programs across our state right now are participating in an intensive continuous quality improvement practicum. That's a national practicum that we're learning from and trying to figure out how we might apply that. So this again is a new requirement and something that we'll be rolling out in the coming year and are definitely planning the support around and technical assistance around. We'll have forms that you'll report on, so you won't have to make those up. Those kinds of things will already be provided as part of the contract. I think that's it on CQI. Any questions rolling in yet?
I'm hearing concerns about the direction of our federal government and the dangers of having identifiable data saved where they could be accessed. How would you address those concerns?
Can you say it one more time?
I'm hearing concerns about the direction of our federal government and the dangers of having identifiable data saved where it could be accessed. How would you address those concerns?
I'm not sure if I'm understanding if the concern is coming from families about the federal government, or if it's, am I interpreting that correctly?
That's how I would interpret it.
Okay. Well, that's a great question. I think that's what we are hoping to be able to provide some guidance around how people can talk about this and articulate in the informed consent the purposes of the data, and also noting that it's not shared at the federal level. This is within the Department of Early Learning and the Department of Health that likely already has identifiable data on many of the families that we serve, though that's not the message, but certainly we'll support some messaging points on that as well. We'll follow up with more.
That's it. Just as a follow-up to that too, maybe one of their talking points could be that our governor has already said that they will not be giving out that kind of information.
Kira, for those of you that couldn't hear, Kira was reminding us that our governor has taken a particular stance on what information the state of Washington will share with the federal government and how protective the state will be of that. So, more people bothering us here. All right, keep rolling. Great. So I think this one's mine too,
Yeah.
and then I'll transition to Cassandra. Okay. So one of the things that we've been thinking a lot about is, given the shift in the partnership between Thrive and the local programs and the Department of Early Learning and the local programs, is that Thrive will still have a role in providing implementation supports through the model leads as well as the other technical assistance coaches and partners at Thrive. And so we're thinking a lot about what it will look like to both work with Thrive and Dell now that you won't have a contractual relationship with Thrive. So one of the things that Thrive and Dell have designed is a self-reflection tool that will guide the technical assistance process over the coming year. And in that, that'll help Thrive plan for and identify the individualized group and universal technical assistance needs of all of the local programs. And that will be a part of the first quarter deliverables, and more to come on that. It's still in development, but that's what we anticipate will help guide the partnership with Thrive and Dell, and it'll be part of the statement of work that you work with Thrive to complete your self-reflection for the coming year as well.
So we do have one more question about CQI.
Sure.
What if your agency has a regular quality assurance process already in place? Could we use this process as our CQI plan?
The question is repeating it. If your agency already has a quality assurance plan in place, can you use this as your CQI plan? I'm going to go back quickly to the November training that we had in CTAC and reminding us that quality assurance and quality improvement are two separate things. Quality assurance is critical. Quality improvement is something a little different. It's aspirational. It's forward-looking. It's not looking at whether we're just meeting benchmarks. So while we'll continue to support you all in quality assurance, we're really looking for quality improvement types of goals. We hope that they're aligned with your organizational quality efforts, and we can work with you on the measures that you're identifying for your plan. But should really be specific to your home visiting program and the outcomes and the services that families are participating in. How do we look at making improvements in those? So that's my answer. All right, any other questions?
No.
Okay, I have one more slide, and then we're going to bring in Cassandra to the panel. And thanks for holding that. I know this is a lot of technical information, and just recognizing again that it will be recorded as well. Okay, so the last one is, and we're only calling this out just because right now this is a requirement in your contract that you acknowledge the funding source in publications, brochures, media, those kinds of things. And this will continue to be a requirement. It will be called out in the statement of work, and we'll provide language about suggestions of how you would acknowledge the funding source in publications. But just again, calling it out, it's already in your contracts. It's just being placed in a slightly different spot, and we'll provide some language around that. So, next one to our wonderful colleague, Cassandra Kugler, who will be talking a little bit more about the budget and financial pieces of the contract.
Good morning, or good afternoon, and morning's already passed. That's how crazy today has been. I hope everyone can hear me fine. My name is Cassandra Kugler, so some of you might have seen me before at all cohort meetings or at site visits. The braces and the glasses are new, so you might not fully recognize me. I've been with the team for about a year and a half, and so I'm just going to kind of walk through the budget, financial invoices, and payment structure. This will be similar to what you did at Thrive, just modified a little bit for how Dell has its payments, invoicing, and financial details kind of set up for our contractors. So in your Dell contract, you're going to have an exhibit, and it's always Exhibit B, and it's going to be dedicated to the budget, and this will be the overall budget from all the funding sources. So we will put out the more specific detailed budget by fund source in the statement of work, using the budget format we discussed in the last webinar and the document that was released in the first release of documents. So the budget is going to be a part of your statement of work.
Yeah, look, I wanted to clarify because I was under, what you just said was what I thought of when I met with our contracts person, and they have the budget actually has to reflect the A19, and that's why the A19, they want to see the total budget with and they have it formatted slightly differently, so we felt that to be consistent with the Thrive format and the way we actually see the budget, that's why it's going to be in two places in your contract. The specific fund source budget using the budget format that we gave out our last webinar is going to be in the scope of work, and that kind of rolls itself into the Exhibit B, which will look like the total budget. So hopefully it won't be confusing that it looks like you have two budgets, but it's really the scope of work budget is the more detailed budget that then folds into what will be Exhibit B. Is that a helpful clarification?
Yes, so to recap, so what Renee is saying is that you're going to have a more detailed budget, and that's going to be a part of the contract. But the Exhibit B and the A19, the way it's broken out in the statement of work, is going to be rolled up payment points. So it's same, it's just going to be same, it's just going to be rolled up. So you're going to see a little bit less detail when you bill us your invoice every month. So there's a couple pieces that we want to make sure, I think most folks are capturing, and it's part of your fiscal processes, but we're going to want to see some backup documentation occasionally, so this is kind of being worked out, and it's more on demand around travel, personnel, and major expenses. So for those pieces, we're expecting that there's going to be documentation saved around them and that we might see them when we do our yearly single audit, that's not the single audit, the fiscal review, that we might ask for some of those records, or we might ask for them from time to time as backup as a part of your invoicing process. So. And the reason I got mixed up is because the next piece is the independent audit. So for those of you who have other federal funds or have had a site visit with Thrive before, you'll know that the guidance from the federal government has shifted. So in December of 2014, there is now a new uniform guidance instead of all these separate guidance pieces. So it used to be called an A133. It's now called a single audit for those that have federal funds in excess of $750,000 a year. And for those of you that just in general operate, you typically have an independent financial audit each year. So folks that have just state funding might potentially just be doing those sorts of audits. So we're still going to be monitoring for that, and more details will come as we get closer to releasing the actual statements of work. DL will also have to show financial compliance. So when we go out to monitor your site, one of the things that we'll want to see is an agency financial policies and procedures document. So this would be something that we would likely look at least once a year. More details to come on all of this.
Question? So we have two. Do you want information on local dollars used to support home visiting, and why?
On the budgeting document, I believe there was a column for the local home visiting program dollars in a single column. We wouldn't expect those to be reported on any invoices, but what we're hoping for is to be able to show how the HVSA funds contribute to the entire budget of the program.
So in the budget that shows up in your contract, that column that we asked for in the pre-contract questionnaire, which has to do with other fund sources, not non-HVSA funding, we wouldn't actually put that column in your contract. So you're not contractually obligated to have that in your contract, nor are you required to report on it. But it is something that we want as a general picture of what our programs are.
And it's in the current capacity assessment as well, I believe, capacity assessment as well, from Thrive.
So we as the state have, because we receive federal monies, we have certain requirements for risk assessment before we start a contract with each LIA or each contractor. So that's one of the things that we just need to review before we issue contracts, and we do it with everyone. It's just the overall financial health of their agency in general. So that's kind of just a quick look for us, just to see.
So the next question is the larger budget the total budget for the HV program or for our entire agency?
There's two separate questions on the pre-contract questionnaire. One is the overall agency budget, and it's just the total amount. And then there's a question about what is the total home visiting budget, and of that, what is the home visiting services account? Am I saying that correctly? We don't, on your budget document, we don't want the whole agency's budget. That's just a single line on the pre-contract questionnaire. And again, to Cassandra's point, it helps us understand, one, if you're obligated to a single audit based on what your revenues are, what percentage is our contract making up of your organization? That's another part of our risk assessment. How likely is it that your organization will, if our contract doesn't go well or does go well, what percentage of the overall agency budget is it? So those are the kinds of things that we have to look at in our risk assessment.
Yeah.
Anything else?
Is that it? Okay, awesome. So I'm going to move on to the next slide, which is about invoices. So invoicing will be similar to how it was done at Thrive. A couple of variances that are important to point out. So our invoicing is called an A19 form. That is generated when we put the budget into our contract system. It's going to generate an Excel document that's going to have the rolled up payment points that we talked about earlier. So it'll match up very nicely. So with that, we're expecting that a monthly expense form, so really provides more details of what was rolled up into the payment points. So it's going to be the same breakdown as you would use with your budget in the A19. So really seeing the breadcrumbs into how the payments kind of roll up into those major payment points. And then transaction details, so your fiscal system detail with a roadmap to the payment points. So we are going to provide further clarification about exactly what this will look like, and I can also provide a sample A19 form if folks are super curious. I know we've done a technical assistance call when we were able to kind of show that and talk it through. It was much clearer. So those are things that we can provide, and you can coordinate through Renee, who's going to provide her information at the end of this webinar, and we can make sure to get you that information.
Could you do a quick definition of what pay points are?
Sure.
Do you want me to take that? This is the second time today I've answered this question, so I'll go for it. Payment points, because our agency allows us to structure budgets in many different ways, it's the unit of payment. So in this case, it'll be the specific line items in your budget. So personnel, supplies, travel, those are the payment points.
Yes. And then I think the budget, document that was handed out in the first batch of documents really kind of shows how that could potentially be rolled up, and is an example of what your budget could look like. So we are also available to answer those questions as well. So backup documentation upon request would be stuff like payroll or timesheets, travel, so the receipts and the travel logs when travel started and ended, mileage, those sorts of things that you would be expected to document to verify that what you're reimbursing for travel meets the state per diem rates. And then major expenses or competitive bids or receipts. So if you go buy a $6,000 computer, those would be great receipts to keep. You might get asked about that when you're being either your A19 is being reviewed or it might come up on your in-person one time a year site visit. And there might be occasional other things. It's really hard to call everything out towards the beginning, but the great thing about it is you're going to have a single person that you're working with who is going to be your contract person, and they're going to be working in conjunction with Department of Health and the model leads and your TA provider at Thrive, and it's really going to be a dialogue and a conversation, especially towards the beginning when we're all trying to figure out exactly what works best for your program within the parameters. So and a good example of this is that when you go and submit your first A19, it would not just be rejected if we didn't like it. There would be a dialogue about what sort of backup documentation was provided and more conversations about those sorts of things. So, and that's what the single person is going to be your point of contact to help work through any questions you have, and they'll kind of have this overall big picture, which will be very helpful. And they'll be knowledgeable in our contracts, processes, and things like that. So they'll be able to really support you through everything. Okay, do we have any questions about invoices?
And we know that that's a new requirement for some of the backup documentation that's not currently required by Thrive and will be required by us. So we acknowledge that that's a new administrative piece.
So the last slide that I'm talking on is around payment, and I believe that we have spoken about this previously. Trying to recall. Yeah, so just to say it one more time, the reason that the process is changing is just due to some state and federal rules that the department is held to. So you're going to be reporting your monthly invoice, your A19, based off actuals. And one of the questions that's come up in one of our technical assistance calls has been around, well, what happens if there's an after the fact adjustment? And there are things we can do, like a supplemental invoice that's in between, or in the next month's invoice, you could clearly call out what was unbilled from the previous month. And so there's a lot of ways that that could be structured, and that would be something that we would want to have a dialogue about. It wouldn't be that you could never get reimbursed for it again once the month has passed. We just want to see actuals and then adjustments from month to month. So, yes.
So the question is, will this be submitted through a similar web-based system as we did with Thrive?
Great question. Our A19 system, so it's a paper-based, but you have the ability to scan it, and send it in an email along with your backup documentation to your contract manager. More details will come out around that specifically later. So it's paper / not paper, but there is no specific portal that you would go in and enter it into. So.
Next question is, some of the draft documents are asking for our agency name, but says IRS name. We are a department of a county, and that would be our IRS name, but contracts are usually done with our department name. How would they, which name would they use, basically?
Gotcha. So we're going to have your fiscal information set up in our systems to route your payment, have your bank account number, and those things are going to be under your official name that you operate as a business under. So if you're as part of a bigger health department, for example, you're probably going to have all your payments going into the same account, and your fiscal folks are going to be processing them and kind of dealing with that and putting them in their specific bucket that they belong in. And then with the contract itself, we're going to be calling out the program and who are the contract people that we're working with for the program. So we're going to have a contract specialist likely. We're also going to have more of a content person. We're also going to have the contact information for a fiscal person. So that's kind of, I think, where both of them are coming in. Just making sure we have the information to kind of report behind the scenes, but you might see your program called out more specifically.
And we can make sure and answer whatever specific questions
Yeah.
this person has in a conversation.
Feel free to send an email, or we can always set up a phone call. And that was it for my section. So I'm going to be transitioning over to Laura, and just wanted to say really quick, we're going to release a lot more details on expense reporting next month. So expect to see that soon.
Renee's talking next, actually.
Oh, Renee, sorry.
So the next slide has to do with reporting and monitoring, and the whole next several slides we're going to talk about this. This slide is a repeat slide from the last webinar. It shows you just the slight modifications between the Thrive structure and the Dell structure, with moving towards a monthly reporting of expenses in addition to your enrollment, and then doing a quarterly progress report and a reflection on enrollment. I added a bullet at the bottom which just talks about, you do an online reporting. There is an online reporting portal with Thrive, and we're working furiously to create a portal through Dell for the same exact process of online submission of both the fiscal information that Cassandra was talking about, as well as the reporting information on a monthly and a quarterly basis. So we're going to go into detail on what each of these reports, where we're going with each of these reports. So if you have general questions, I can take them now, or we can move specifically to, for example, the next one's the monthly report. Okay, keep it going. Monthly report. So our thoughts are that this report would be due every month, no later than the 25th of the following month. It would include, and it's really very little change from your Thrive monthly report right now, with including organizational information, who's on your active caseload, any changes to caseload, and enrollment. The only difference here would be that we would be asking this, these are, when we ask numeric information, we would actually want to know by fund source. So while you're only submitting one report, we're going to ask you numbers on how many children and families are actively enrolled, funded through McVie, or funded through TANF, or funded through state general funds. The same for all of these. And this is where we have that questionable indicator around, are there families who are receiving that second visit. So any questions about the monthly report? It's going to be slightly staggered with the fiscal. You can certainly turn the fiscal in with the monthly, but we want the monthly by the 25th, the fiscal by the 30th. They don't have to come together. So.
Oh, sounds like we're having some technical difficulties with some people being dropped.
Uh-oh. Uh-oh. We're having technical difficulties.
We're going to take a quick pause. Or do we have about the same number of people now than we did? 47 on.
We still have 50 out of 100. Okay, they're back to hearing now.
I don't want to miss questions on the monthly report before I move to the quarterly. Okay. So the next slide, what we've actually done is taken the quarterly report and we've reduced it, and we're considering doing slightly different quarterly reports depending upon which quarter. So the first quarter, we'd see some things that are different from the rest of the year. All quarters, we would want an update on your staffing and supervision that's going on, any new staff, and a report on what type of, how much supervision is happening. For example, how many hours of reflective supervision. We would want to see that still quarterly. We'd also want to know information about your referrals, which Laura referred to earlier, and any organizational or community updates. We heard a lot of feedback in December around some of these kind of contextual, I want to call them qualitative questions. Things don't change that often, and we were going to give you an option to say, hey, nothing has changed, but we still wanted to remind you about, did anything significant happen in your community this quarter that would impact the implementation of your program, or what's happening, what families are experiencing, so that each quarter you would reflect on that. But there may not be change, and so we wouldn't expect you to fill it out if there isn't change. We don't want you to just keep spitting back the same exact information every quarter. So we're going to give you that. We're going to try to create the form in such a way that you can say no change. You could certainly type in no change if we don't figure it out any other way. So that's kind of what we're thinking about for all quarters. In quarter one, there are certain activities that we think are going to be happening in the first quarter that we would like some reflection or report on, which would be including that TA, the self-reflection process that you're going to do with Thrive, as well as the planning for the CQI work that you're going to do the rest of the year. So we would only need that information the first quarter. In the second quarter, the difference is that fidelity letter that we talked about earlier. Then quarters 2, 3, and 4 kind of reflect or mirror what we see in quarter 1, and that we want your reflection on what's happening around TA, what impact you might see happening on your program or how it's going with TA in your quarters 2, 3, and 4 reports. And then in CQI, we want a report on what's happening in CQI. And again, these are all things that we're going to specify questions and give you formats so that you don't have to just reflect on it and then give us your reflection kind of thing. And then finally in quarters 2 and 4, we would ask for a parent success story, which I think is asked for every quarter right now. So that's generally what we're looking at. Certainly this is still in planning phase, but are there questions, Kara? It looks like you have.
Yeah, we have a couple of questions. One, just wanting some explanation on to what referral summaries are.
I think we maybe someone asked that earlier.
Yeah.
And I believe this is currently, and a Thrive staff person can chat in if I'm saying this incorrectly, but it's a summary of what kind of referrals you made over the last quarter. And this is it's in your capacity assessment. I think it's your top 10 referrals that you get in, where are they coming from, and out. So again, what are the needs of your families, and what are some of the themes of the kinds of referrals that you're making. So it would be the types of referrals that you're making aggregated for your families over the last quarter. Summarized is maybe a better word for over the last quarter.
And if you're doing this right now, and you may have some suggestions. This is where we could use some feedback when you look at the quarterly report. So.
Okay, so the next question is, have the program models agreed to provide fidelity letters?
Yes.
Any other questions? Have the program models agreed to provide fidelity letters? The answer is yes.
Yes. Yeah, the only one that is a little nuanced is the Office of Head Start for Early Head Start. And I don't know who asked that question, but we've already talked with Parents as Teachers, Nurse Family Partnership, and Parent Child Home.
Quarterly reporting, any other questions before we move to the next slide? The next slide has to do with your in-depth fiscal review, and it's in partner with our annual site visits, which will happen. These will happen in the third and fourth quarters of the year. When we say a desk fiscal review, what we mean, and I think that Thrive is currently conducting these, and so there really isn't a whole lot of difference between what Thrive has been doing with you and what we will do. But it means that you'll get an email or an official letter asking for certain documents to be sent electronically to you. You will respond to that email, send these documents back to Thrive, and they will sit at their desk and do the review. And what we're looking at that containing are kind of two general sections. First is really financial capacity and compliance within your organization. So it's understanding, potentially doing a self-assessment on what your policies and procedures allow for to ensure that there's kind of appropriate fiscal protection, security, and the compliance. That you would provide us with your most recent annual audit if it's more recent than the one you submitted in July when we asked for it. You would submit your Form 990, which is your tax return. If you're a nonprofit, I think if there's any for-profits out there, it's a different tax return. But and there may be other financial documents that are asked for. It could be if you have a large contract, large subcontract or something like that. There may be other documents. We haven't actually worked out the details of that, but we will. We're hoping to work all the details of what these documents look like prior to the release of the contracts. But this is something you would get a lot of heads up about. So that's the first section of the desk review. The second section is really a much more detailed look at your expenses, and Doug Coleman asked for this from Thrive, a 1-month general ledger, and then they do some sample testing on that. So we would look at your detailed expenses for a specific month and do some testing around looking at specifics around payroll, travel, and other major expenses, and asking you to document certain things. We'll probably ask you for 3 or 4 different timesheets from staff during that period of time, We'll ask you for travel logs or mileage statements. I think this is something that Cassandra alluded to earlier in terms of backup documentation, and we'll be just looking, it's like a honing in on 1 month, and that's what Thrive currently does, and we're actually using their guidance and their procedure manual to drive the procedure manual that we develop, so it shouldn't be very different. Then we would take all that information and follow up with you at the on-site visit. Are there specific questions about this?
The question that we have right now is, will you be getting the referral summary quarterly from the NFP ETO download?
The referral summary from the ETO quarterly download. I'm not sure if I totally understand the question. DOH may have access to the referral data, and my assumption would be then that programs also have it. If there's a suggestion for how to report that differently, we'd like you to take the opportunity when we release the documents for the quarterly report to provide some feedback about ways that we're asking for that data.
We're laughing because it feels like we can see the thought process working out in the local level that we were, that maybe we
immersed it.
Yeah, if we're immersed in what we're doing on one slide, and there's still thinking going on the last slide. So, any questions on the fiscal review slide? Okay, we only have 5.
We have one more question. When will we know who we will be working with on our contract so we can ask some specific questions?
For specific questions right now, they go to Renee or the home visiting inbox, and we'll respond back to those. We still have to hire some folks and assign them contracts, and we won't do that probably for another 2 months or so. So then we'll identify and sort out what we would be calling kind of our caseload of contracts as well. So right now it's Renee in the home visiting inbox, and specific questions, bring them on. We'll respond. But please remember that these are the draft contracts. These are not the final contracts. Those are set for release in May.
Yeah, so exactly. What we're hoping is that by May, when your contract is released, you'll have a person attached to that contract with a phone number and an email. So.
For NFP, not all clients get a second visit. It depends on the timeline in the program. Some get 4 per month, some get 1. Also, NFP allows alternative scheduling more or less per month, and it still meets the fidelity, the model. Question, how do you see NFP getting incentives based on my comment earlier about timeline requirements for home visiting and alternate schedules?
Well, I think that's where we want your input. Our assumption would be that based on the enrollment schedule for families, there would be an average number of visits. So given that it could be 4, it could be 2, it could be 1, that over the course of the month, you'd have families enrolled at various time points, and that they would have, on average, we would expect there to be 2 visits per month for the entire caseload. But that's where we really need your input and for us to think about that, because we don't have it defined yet.
And this is something that we would customize to program model. So, and recognizing though that you're customizing the number of visits to your person, the people you serve, and when their pregnancy is compared to when they birth is. So, So, are we ready to go to the next slide, which is the last content-rich slide? One more question? No, go on. Okay, so the last slide has to do with the annual monitoring visit, which again, the fiscal review feeds into that visit, and our annual monitoring site visit will take place either in the 3rd or the 4th quarter. We'll give you plenty of lead time to make sure it works for everybody involved. You should be thinking when you get that invitation or when we set up that meeting, who on your end might want to be involved in that. We're thinking certainly your program manager for home visiting, any key contract monitor, manager, staff, or fiscal staff, and then maybe relevant agency leaders, with the idea that we're going to divide the visit up into 2 major kind of categories. First is a program review, where we look through your performance and milestone progress. It's an opportunity. When I worked in a nonprofit, it was our opportunity to really kind of brag about what we were accomplishing and what we and to think about that, not just kind of in this written reporting format, but take a step back and look at overall what you're accomplishing in your communities through your home visiting program. We'd also look at doing any kind of review on deliverables that we've identified in your scope of work that we don't want you to report in on us on a monthly or quarterly basis, but we still want to check in on. And those would be things like a staff training log to make sure folks are up to date on their professional development requirements related to the model and the HVSA, things like that. It could be a review of select case files to make sure that folks are, completing parent consent forms, or that they're, there's just kind of random file review in that way. We also want you to have a chance to report to us about how it's going with your the other partners in the HVSA, the Department of Health and Thrive, and get a chance to share your progress on the different things, the different projects you're working on with them, whether that be CQI or TA or any other thing. And then any updates in terms of what's happening with your community and your organization. That's the first section. The second section will be a fiscal review, where we do any follow-up that would happen with the desk monitoring. The majority of the fiscal review is going to really happen prior to this visit, and this is just a follow-up where some discussion or clarification or answering questions might occur. After the annual site visit, there may be follow-up on the part of DEL if there's areas where we had questions, or there were areas identified where there need to be some improvement. So that's the annual site visit. Any questions? Nope. Okay, this is a reiteration slide. I wanted to say there's constantly going to be support for you around your contract assistance. We're thinking about that even now, how we're going to administer technical assistance as we introduce the final versions of all of these documents. But we certainly, you have going to have one opportunity for one-on-one conversation with your contract specialist once they're assigned. And we're going to develop a manual with some resources online so that if you're get things in terms of written format, that'll be available as well. Question?
So you have a question about the annual visit, and that is, will Dell and Thrive TA staff all come for the same visit?
That's a great question. Would love to hear any feedback from you on whether that would work well or not. I think ideally we would pair it with site visits, but haven't gotten that far in sketching it out.
Yeah, definitely want input.
Any questions?
Other questions? And then the last slide just summarizes. This is what we're going to send out by the end of next week, hopefully, as a sample, generic statement of work, the template for the monthly report, the enrollment report, the template for the quarterly report, and the aligned performance measures. So, and then this has my phone number and the home visiting inbox address on it if you want to set up an appointment to talk.
And we'll provide some text in the email that accompanies the documents about how to provide feedback and the timeline for that. And one last thing is, I think we've gotten just a couple of comments in the home visiting inbox about the pre-contract questionnaire, but if there are others, we need that feedback by the end of this month.
Yeah.
So February 28th, and we'll conclude our kind of input process on that at that point, because we need to launch it in our system. So that's the only other piece. So thank you very much for sticking with us.
Yes.
It looks like we have one more question. We're at 2:30, so we'll answer that question, and if others have those, but honor time if people have to jump off as well.
So it's just, are the first set of documents on the website? Don't believe they're on our website currently.
No. And we didn't put them on the website because there were 3 different emails that went out, because there are a few templates that are specific for different organizations. So if you didn't get them, please email and we'll send them to you, as we didn't want to put the draft in when there are various documents on the website to confuse people further.
We know this is a lot of information, and it's you can see these as kind of the, what do you call it? It's the betas, right, of everything. So the idea is for you to not have to digest and know it all specifically. It's just to get a sense of where we're going and to weigh in, particularly in the areas where I think we've identified during today that we would really like input. And to get a sense of, if you see these changes being major, how that might impact your administrative load. So, great.
Alrighty, well, we'll hang on for just a minute if you're still typing in your question, but thanks again, and keep emails and questions coming by phone or email, and happy to follow up. And we don't have another webinar scheduled, but we'll likely do one again after the actual contracts are released in May or June. So more to come, but not any imminent webinars. Thanks for hanging in there.
Yeah.
We do have one more comment, Lawrence. The email stated that we could provide feedback on all the forms until March 10th.
Oh, okay.
All right, well, we were confused.
We'll honor that. If we would really like input on the pre-contract questionnaire
That's the only
earlier
one.
than that. If you can't do it, you can't do it. But we're trying to build an IT system with that, and so that's why we just pushed that deadline up a little bit so that we could, and trying to make this something that you can give to us in an online portal. We needed a little bit of extra time for that one document.
Sorry about that.
Yeah. I guess I should read the emails I write.
Too many emails, too many documents.
Yeah, we're starting, you can't tell, we're starting to.
All right. Well, we're going to close the recording, so thanks so much, everyone. We'll always take questions